The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to the Children's Cardiomyopathy Foundation's webinar on coping with the diagnosis. We are glad that you are joining us this afternoon, and we hope that the presentation is helpful and informative. Before I turn the presentation over to our guest presenter, Dr. Monteiro, we just have a few housekeeping notes before we begin. So if at any point during the presentation you need any technical assistance, please type your concern into the chat window, which is on your control panel. And if you have any audio issues, you should be able to switch between using your computer speakers and calling in via a phone number if you need to. And in order to provide the highest quality session today and avoid background noises, all attendees are in listen-only mode and are muted during the presentation. Your questions are encouraged and welcome during the presentation. Questions can be submitted via the question box located on your control panel on the right hand of your screen. We will be taking questions during the last 10 to 15 minutes of the presentation, so please feel free to submit your questions during the presentation as you think of them, and then we'll address them at the conclusion of the talk. We will also be recording this webinar today and posting it to our website so that you'll be able to access the information again at a later date if you need to review it again or share it with another family member. And without further ado, now I would like to introduce our presenter. Dr. Sonia Monteiro is a developmental pediatrician at Texas Children's Hospital in Houston, Texas. In her role at Texas Children's, Dr. Monteiro has a particular interest in taking care of children with congenital heart defects and how to best help both the child and their family through this diagnosis and these disorders. Thank you so much for joining us today, Dr. Monteiro, and welcome.
Thank you for having me.
Thank you. I can see your screen, so I think we are all set.
Okay, perfect. Well, I'll go ahead and get started. Like Gina mentioned, I'm a developmental pediatrician, and so I'm at Texas Children's, and I'm going to go ahead and get started with the presentation. So with any new diagnosis, there's going to be a lot of emotions that families will experience. Denial is actually a coping strategy. For many families, it takes a while to process the new diagnosis. And so, you know, it's a serious, acknowledging the diagnosis and its seriousness takes time, and this sometimes will allow families to have time to process. Denial, though, can, be harmful when it prevents or delays treatment of the condition, as well as, for many children with chronic illness, denial of some of the restrictions that they might feel might be imposed on them may allow them to continue to push forward. Another emotion that we frequently see is anger, and that can be experienced by everyone. Parents may experience anger for many different reasons. They might have anger towards their child for being sick and some of the stresses that it's bringing on the family. This might include financial stress, stress between parents, and stress, about how they're going to manage this new diagnosis. Spouses might have anger towards each other. They might feel that one parent may not have taken the child to the doctor, soon enough, and might not be there as much as they should. And also, parents might have differing opinions on how best to care for the child. Even siblings can feel some anger, towards the lack of attention that they might be receiving, and some of the stresses that the new diagnosis is bringing on the family. Additionally, some other emotions that we frequently see are feelings of sadness and depression. When you're processing a new diagnosis, families and children might experience, intense grief over some of the restrictions that are now, being placed in terms of children feeling that some of the activities that they were previously able to participate in, they no longer can do. They might feel isolation in terms of, from their friends, from their classmates. They might not feel different. They might feel as though they don't fit in anymore. And, for parents, in terms of their sadness, they might, feel like they've lost control and blame themselves, and that they've failed, to protect their child from the illness and diagnosis. Depression is quite common in chronic illness in general. Between 25 to 33% of individuals, affected by chronic illness experience depression. Some of the frequent symptoms we might see include changes in appetite, social and physical isolation, and so it's also just a very common, depression is common as a long-term complication for chronic illness. So it's very important, for families to be aware of that and feel comfortable, mentioning some of these emotions to their healthcare provider. Additionally, we frequently see, families experiencing a lot of fear and anxiety when given a new diagnosis. And, there's a lot of worry about what's going on right now, as well as, what might go on in the future. And also for children, with hospitalizations and treatments and procedures, they might have a lot of fear, around those events. Some of the additional emotions that we frequently will see with our families and patients are feelings of helplessness and frustration. So there might be frustration towards, what's going on and having to rely on others and that loss of independence that many families previously had. With all these different emotions, it's very common for families to kind of cycle through the emotions. They might be feeling all these emotions at the same time. They might change day to day. So it's just important to be aware that, what you're feeling and experiencing is very, very common for many families. So as I had mentioned, I'm a developmental pediatrician, and we always like to think about things in terms of developmental level, in terms of where the child is in their development and kind of where their cognition and understanding is. And also, with a diagnosis, things will change over time, and children, as they develop, their understanding will change over time. So for our toddlers and preschool age children, in terms of where they are developmentally, kids at this age, between the ages of 2 and 6, are really unable to separate themselves from their environment. They're very self-centered in their thoughts, and are at the same time are very interested in becoming independent. Preschool age children and toddlers, they develop kind of an understanding that, good behavior is rewarded and bad behavior is punished. Therefore, when a child has a diagnosis or is sick, their understanding might be that this is the result of their misbehavior. So, for example, they might think that they got sick because they hit their brother. So for parents, you might take a lot of repetition to kind of help, your younger child understand that this is nothing that they did in terms of their diagnosis. So in terms of some of our older children, in terms of where they are developmentally with understanding the diagnosis, our school-age children, of course, have a greater ability to understand a diagnosis, but they don't have the same response that we would see necessarily in an adolescent or an adult. So school-age children are typically very concrete in how they think about things and how they understand cause and effect. And they might also, school-age children are very focused on their friendships, and they might they have a lot of worry about how, this diagnosis is going to affect, their ability to go to school and to participate in their day-to-day activities, as well as their peer relationships. So then, as we kind of move on to our adolescent age patients, this is kind of a time of, great change. A lot of adolescents are building their own self-identity that's outside of their family, and they want to be independent, and their self-image is extremely important. So when an adolescent, receives a diagnosis, this can be very challenging. They might experience a lot of anger and resentment towards their parents because previously they might have been very independent in their functioning, and now they're having to rely on their parent for assistance. So this might be a stress and a challenge from that angle. Now, parents at the same time, having an adolescent, you might have grown accustomed to having their child be fairly independent, and so having to take on the role of primary caregiver is also an adjustment that parents will have to make with a new diagnosis. So I now wanted to just talk about coping skills. Coping skills are what we frequently will do or think to kind of help us get through a difficult situation. So many children, prior to receiving a diagnosis, have developed coping skills at some level. So parents, it's important to kind of build on what's already there. So these strategies that are kind of on this slide are just general that apply to kids of all ages. So even, it just might seem really basic in terms of listening and talking, but children want to know that they're being heard. So they want to make sure that their, parent is taking into account, their perspective. Even if parents feel, there's not an immediate way to fix what's going on, when they listen to their child and kind of acknowledge, what their child is saying in terms of their feelings, that can really support their child and help them cope. Especially if the child's, voicing concerns about an upcoming doctor's visit, a procedure, a new medication. A parent could always say, something like, it sounds like seeing Dr. Smith is very, upsetting or scary for you. What can we do to make it better? And so kind of just saying those things to support your child can be very important. At the same time, if we, as parents, if we talk too much about what's going on, for some children that might be too much. And so hearing all that additional information might add to their stress and kind of give them new things to worry about that might not have, been there before. Parents can also help by modeling some coping strategies. So, or demonstrating them to their child to kind of build again on what might already be there. So, and this can be very challenging for parents because they too are, they're receiving a new diagnosis, and so they're having to cope themselves, but then they're also, supposed to be modeling coping to their children. So just as an example, a parent could help their child by saying something like, let's take some deep breaths to help us calm down, or, let's go somewhere so we can relax. So kind of for their sake as well as their child, just kind of modeling, some coping strategies can be very, very beneficial for both parent and child. So I think it's really, really important for all parents to kind of encourage their child to ask for help when they need it. This is the skill their child will need long term, and this can prevent a lot of frustration from many sides. It can prevent frustration on the child's part, in terms of getting their needs met, in terms of from the parent, if the child's being hospitalized, or they're not able to be there, 100% of the time, having the sense that your child is able to ask for help when you're not there, I think can relieve a lot of stress. And, additionally, even, for children attending school or other activities, they should feel comfortable, if they need to take a break, being able to ask for that and not, feeling scared to do that. At the same time, it's with a new diagnosis, this is a very big stress on a family. There's a lot of changes going on. It seems like it's a very overwhelming situation. And so, one of the other things that we would recommend for parents with children of all ages is to try to provide as much structure and continue routines that were, were there before, the diagnosis, as much as possible, and also, try to set limits. it's hard, it's really difficult for things to stay the same, but having the same bedtime, having the same routines, the same family meal times and the same rules in the house can really be reassuring for a lot of children to know that even with this major diagnosis that, some of, the main things at the home are staying the same. Sometimes if things change and some of these routines are lost and the rules are, not in place, some children might interpret that as, things must be much worse than they are because, we're not having to do what we had to do before. So it's really important as much as, possible and, to keep your routine and some of the things that were in place prior to the diagnosis. So now I was just going to kind of talk more age by age in terms of specific coping strategies. So we were going to start with infants and toddlers. So developmentally, this is a stage where trust develops and attachment and security. So infants and toddlers are developing that attachment to their primary caregiver or parent. And this process that takes place in the first 2 years of life can be complicated by, by a chronic illness. As we know, infants and toddlers are going to not really have much understanding of their illness. They'll still notice that some things are different. For example, if they're hospitalized, they'll notice that they're not sleeping in their own bed. And other small changes in terms of the new people that are, in their environment. It's important, for parents to make sure that we're developing this trust by trying to be present as much as possible for hospitalizations, for procedures. And parents can also be encouraged, to interact with their child as much as possible through play to kind of further that attachment and trust and lessen some of that stress. For our preschool age children, like I had previously mentioned, again, they still have a pretty limited understanding of their illness. Some common fears we might see in preschool age children include kind of fear of the unknown, fear of being separated from their parent or their caregiver, fear of, of injury or pain, and that loss of control. So as I had also said, children, preschool age children, might view, the diagnosis as a result of a misbehavior. So they need a lot of reassurance that their illness is not their fault or a result, of any of their actions. So at this age as well, for our preschool and older toddlers, they want so much to be independent and do things for themselves. So allowing them as much independence really promotes their development. So this can be done by giving them choices. So for example, a parent could ask their child, do you want to take the pink medicine first or the white medicine? So even just simple choices kind of give a preschool age child the confidence that they still have some control, over what's going on. And it prevents, the child from thinking that everything is out of their control. For many children, if they just feel that they don't have any control or any say, especially at preschool age, we might see more challenging behaviors in terms of tantrums, aggression, talking back. So trying to give them some independence, when appropriate, can be very helpful for our preschool age kids. So some coping strategies for our preschool age kids are play. So children, of course, love to play, and so activities that the child enjoyed, prior to diagnosis should be encouraged. And play in general provides a form of distraction and can support and comfort, the child. For example, medical play, if you have a doctor's kit at home or a children's book that's, at their child's age of understanding about going to the doctor can really help, a child, get through some of the fears that they're having. Also, at preschool age, kids want to know what's going on. So, I would, recommend maybe a few days prior to a doctor's visit or a scheduled hospitalization or procedure, a parent can sit with their child and kind of explain in very simple terms, what to expect. Parents should really, I would avoid too much detail. So again, we don't want to, give too much information so that the child is worried. And again, we have to keep in mind what are they understanding. And children should be encouraged to ask questions if they don't understand. And again, reinforcing that, the illness is nothing that they did. It's not, it's not the result of any misbehavior. And also, like I had said before, parents of preschoolers should encourage their child to talk about their feelings and their fears and provide reassurance. These are some other activities on the slide that talk about some other strategies specifically during a procedure that are helpful for our preschool age children, blowing bubbles, listening to music, singing, talking about our favorite things or places. These activities can really help parents engage with their kids. So for our school age patients, like I had said, previously, they're better able to understand their diagnosis. So many school age children have very similar fears to the preschool age kids, such as pain, loss of control, loss of independence. So as I had also mentioned, a lot of school age kids worry about, their friendships, grades at school, tests, feeling left out, or, the potential of being bullied. So these are just typical worries that all school age kids experience. So with a chronic illness, a lot of these worries can worsen, especially if the child is absent from school for an extended period of time. And also, even if there's just intermittent school absences, this can also have an impact on learning and social skills, and potentially, without close monitoring, can lead to behavioral and emotional difficulties. So, parents should encourage their child to continue to participate in school and other activities to minimize these risks. And it's really important for all children and school-age children to maintain their identity outside of the role as patient, just so they have a sense of normalcy. So additionally, for school-age kids, some of the strategies, like I had mentioned with the preschool-age kids, parents should be encouraged to talk to your child about upcoming doctor's visits or, procedures. And let your child ask questions. A lot of school-age children are going to want to know why are they being hospitalized, and it really has to be explained in terms that the child can understand. If there are questions that the child has that you can't answer or a parent can't answer, the child should be encouraged to ask the medical team. We want them to be an active participant in their care, and that prepares them as they get older to be an active participant. And just talking about play again, play for school-age kids can also be a powerful distraction in terms of kind of keeping their spirits up. These activities might be a little bit different. They might have more interest in, reading, puzzles, drawing, watching movies. And also, school-age children should really be encouraged to continue their friendships and their interactions with their peers and family. So whether that's through FaceTime, phone calls, emails, we want children to stay connected because that's going to be a great way to kind of provide them with the support and keep those relationships going forward. For parents, I would encourage you to maintain close contact with teachers. Let them know if we're anticipating any absences, and feel comfortable requesting modifications or accommodations when appropriate. This can kind of keep everyone on the same page and prevent any stress down the road. So for our adolescents, like I had said before, the teenage years are a time of great emotional and physical change. Adolescents are working on their own identity that is independent from their parents and other family members. So with a new diagnosis, they might experience, a lot of resentment towards their caregivers because they've lost this independence that they previously had. Adolescents might have fear of becoming too dependent on others with tasks that they used to be able to do by themselves without any assistance. And like I had already mentioned, for our adolescents, self-image is very, very important and crucial. So if there's changes in regard to their physical appearance, this is going to be stressful because they will think it's going to possibly change, how they're being perceived by their peers. It's very common for our adolescents to go through a phase or a stage of denial with regards to receiving their diagnosis. And this could potentially, if not monitored, it could result in non-compliance in terms of taking medications or following their treatment regimen. So parents and caregivers, it's really important to keep in mind that they're going to need monitoring to make sure and support, encouraging your adolescent to be independent in terms of their care, but keeping in mind that they're also going to have to keep a close eye to make sure that they're getting all the care they need. But it's also, I would emphasize again, that the parent should let their teen make decisions, when appropriate, so that they maintain their sense of, independence. And they should be, active participants in discussions about treatment. And again, like I mentioned with some of our younger children, they should be encouraged to ask questions of both their parents and their medical team. So, they might, adolescents might experience some frustration that no one understands what they're going through. So again, we would encourage parents to try to connect their teen with a support group that might be specific, to cardiomyopathy or to similar chronic, illnesses. Just so they feel that they have a community of peers that is, experiencing something similar. Also, some other activities that, can be very helpful is if the teen likes to write in their journal, talk on the phone to their friends, listen to music. And again, like I had mentioned with our school age kids, maintaining friendships and school involvement is crucial because that gives them that additional support. So now I was just going to talk about siblings. With all the stress that comes with a new diagnosis, siblings can sometimes be forgotten. But they will, the child with the diagnosis will have a lot of questions. So again, as I'm a developmental pediatrician, we have to think about the sibling in terms of where are they developmentally in terms of what they're understanding. So kind of breaking down, the diagnosis for the sibling in terms that they understand. And so the siblings will also need that reassurance that the diagnosis is not their fault. It's nothing that they did. They're not the cause. It's very important, even if parents think that, well, they're old enough, of course they're not worried about that. Just hearing that can provide a lot of reassurance. So this can be difficult, but when possible, it's important for parents to try to spend one-on-one time together with, the sibling. So to let them know that they're still important, even, when the other child is being hospitalized, calling from the hospital to let them know that they're thinking of them, just to keep them, involved. Also, we talked about how for the patient, we need to talk to the school and let them know what's going on. The same should be done for siblings because the siblings are going to be experiencing a lot of stress with the diagnosis. So their teachers will also need to know, what's going on at home, the changes. So it's important, that the school knows, so that the teacher is noticing any changes in behavior, they can let the parent know before things get too out of control. And as well as, in addition to school, any activities that the sibling might be involved in, sports, people should know as well. So the next topic we were going to talk about was parenting stress, and so how to care for yourself when you're facing, this new diagnosis. So parents of children with chronic illness face a challenge of establishing a new normal for their family, for themselves, for their child. It's a lot to take on. So it's important for families just to remember to take each day as it comes, and try to focus on what's going on right now and not putting too much time or energy into the future, and not speculating or focusing on, the what ifs. But it's very, very common for families to just feel completely overwhelmed with the diagnosis and the amount of information that they're being given by their medical team. So having that time to process everything is crucial. So for many families, having to hand over the care of their child to someone and putting trust there is very, very, very difficult. And so if families or parents need information to be repeated or re-explained, this should be encouraged. If they don't, because a lot of times, parents need to understand so that they can then explain to their child. This is going to, by asking questions and having information repeated, it can potentially avoid any confusion or frustration later on. It's important we encourage all our families to really try to partner with us. We're on your team. We want to help you and your family as much as possible. We're all working towards the same, best outcome. So just remembering that, especially with asking questions, if you're questioning something, feeling comfortable, just making your opinion known, I think is really important for families. So, what would we recommend for parents? What can they do for themselves? I know we spent some time talking about different strategies for children of different ages. It's important for parents to ask for help. This can be very difficult to ask for help, but it can lessen a lot of the stress. Additionally, for family and friends who want to participate and be involved and help, it can help them feel involved with what's going on. Many people might want to help, but they feel uncomfortable volunteering. And so if you ask for help, you can get those people to kind of help relieve some of the stress. And when people say that they want to help, it's very helpful to give them specific tasks to do. So sometimes people will volunteer to help, and you might feel uncomfortable telling them specifically, oh, can you bring dinner on Wednesday? But that gives them something to do. So don't be afraid to ask for something specific. So even parents need a timeout. I know when we think about timeout, we think about our toddlers and preschoolers. But with the stress of a new diagnosis, when parents are overly stressed, we've seen that stress can translate over to their children and cause their child to experience more stress. I know when we travel, we're always told to put our oxygen mask on before we put the oxygen mask on for our child. So kind of taking time to care for ourselves is very, very important so that we're better able to take care of our children and kind of taking time out regularly to kind of recharge. So I can't emphasize enough the importance of getting rest and exercise and diet. It can be difficult. I know it'll vary on what's going on at the moment, but just keeping that in mind. And also for families, taking time, with your spouse or significant other is very important because you want to maintain that relationship, because that is itself a very big source of support for the family unit. So with a new diagnosis, many families have the question about, well, who should we tell? Who do we have to tell? And that's a very personal decision for families to make. So many parents might worry that they don't want to upset, other family members or friends, and they might feel that they need to just provide very limited information initially. And when we give a new diagnosis and when families, explain that to their family and friends, we see a lot of different responses, and that depends on the relationship, how close they are, and just the other person's, experience and understanding. So sometimes, it might be helpful to kind of assign one person to be the update provider. So when there's a change or something happens, instead of, you having to tell everybody, if we have someone assigned to do that, that can also kind of alleviate some of the stress of having to constantly repeat, the information. And also it can be helpful in terms of preventing the spread of any information that might not be accurate by making sure that the same information is coming from the same person. In terms of informing others, I would encourage parents, if who are working, to let their supervisors and colleagues know about, the situation, so that if there's time, if they need to take time off or there's appointments that they know are coming up, everything's kind of understood in advance. So we kind of had talked about the importance of school in both, our school age and teens, but it's important for parents to inform the school of what's going on. Children are not always going to want to be, telling their friends and teachers because they don't want to be perceived as being different. At the same time, parents might be hesitant to let the school know because they might fear that it might change how their child is perceived, or that the information might be spread inaccurately, because it is a larger community. However, it is important to kind of make sure the school is in the loop. Parents can make sure that the information the school has is accurate, by providing, online resources, printouts to share, when appropriate. And also families can let their child's teacher and staff know, when it's appropriate for them to send cards or letters of support. So that can be a huge source of, support for the child when they know that others are thinking of them. It can be very beneficial. So when there's any changes, it's also important for families to kind of keep the school updated with what's going on. Kind of going forward. So, one of the last things that I wanted to talk about was just the importance of building a support network. So just remembering, what we talked about when we discussed, asking for help, that having the support of your family and friends is very important when you're dealing with a new diagnosis. So, but at the same time, there are other ways of receiving support through online groups, blogs, and other forums. So, and many hospitals have, support groups that meet up where you can meet other families who are going through the same experience. And this can really help families with feeling less alone. You can even bring another family member if there is a support group, so that they have a better understanding of, what they're going through. Some families might feel better kind of with an online support group where they don't have to have a face-to-face interaction, but sometimes having, a face-to-face interaction can provide more, support. And families should never feel afraid to seek, counseling or therapy for themselves. or their child when it's needed. I think it's better, to be proactive if they feel like this has just become too much, because therapy can be a great source of strength in terms of how you're thinking through things, and kind of planning for the future. So those were kind of my thoughts on kind of coping with a new diagnosis. I was now going to kind of turn it over for any questions that anyone might have.
Thanks so much, Dr. Monteiro. That was a great presentation, very informative. We do have a handful of questions that have already been submitted, and so if you have any other questions that you wanted to submit, go ahead and type them in now, and we'll get through as many as we're able to. Of course, Dr. Monteiro will be able to comment for general questions. Of course, if you have specific treatment-related questions, we encourage you to talk directly to your medical team about those specific case concerns. But here are a few general questions. Okay, the first one is the question is that her child was diagnosed with cardiomyopathy at age 15, and now he's 18. And she's never asked the doctor about what the prognosis is. And it seems like something that they might want to talk about instead of avoiding it. But is this advisable? Should the parent ask the doctor? Cardiomyopathy is such an unpredictable disease. So what would you advise for this teen?
I would recommend asking about the prognosis, because at 18, that's such a time of major decisions about, the future. And a lot of teens and adolescents, I feel, know more than we give them credit for. And especially if he or she's wanting to know, I think they're, essentially an adult, I think that information can be very important for them to have.
Okay, great. Thank you. Another question. This comes from a parent who is also diagnosed with cardiomyopathy herself. Do you have any suggestions for how to help family members get out of the denial stage? This person's adult children don't feel like she is sick and that her diagnosis is not really a big deal. And she's looking for some guidance on helping her family with that.
So that's a difficult question to answer. I would say, I know that the Cardiomyopathy Foundation has a wonderful website with excellent resources. I would direct the family to look at those resources. But at the same time, I know it's important to have the support of your family, but if it's a negative in terms of having to re-explain yourself when you need support, if there are family members who are understanding the diagnosis, kind of seeking their support, and kind of trying to limit exposure to any kind of, doubts or, family members who don't have the same understanding, I think is important. But just education, I think, is really important, because for a lot of people with chronic illness of all types, a lot of times physically and on the outside, there is nothing different about them. And to try to explain that to family members that they have a very serious chronic illness that they're dealing with, the extra energy and effort that has to go into that can take away kind of from day to day. So I think education, and then trying to surround yourself, with people who do understand what you're going through is very important.
Okay, thank you. Another question is, what would be the best way or suggestions to explain to a school-age boy why he is not able to participate in sports like his friends can without scaring him?
Okay, so for that, I would explain to him that there are some differences in his heart that make it harder for him to play, and that we have to be more careful with his heart to make sure that he doesn't get sick, but that we can find other activities that, he might enjoy, that can kind of take the place. But I don't, I don't have any resources off the top of my head, but just kind of trying to explain that, not too much detail, but explaining that, his heart isn't able to do the same things as his friends, but his heart is able to do some other activities that aren't as physical, and kind of finding some of those other activities that are more appropriate. And I think for a lot of school-age children, that's something frustrating to hear. So he or she might need to hear it a few times, but kind of trying to find other activities where there are other kids to interact with that aren't physical, I think is a great way to kind of substitute for sports.
Okay, great, thank you. Another question is, what would you suggest saying to a sibling who is genetically positive for cardiomyopathy, so known to be at risk for cardiomyopathy, asking if he might get the same disease as his brother is also diagnosed with?
So some of that depends on the age. I don't know if it's a question if we have the child's age.
We don't. If the original poster wants to just type it into me quickly, I can.
Yeah. So
how old the sibling is?
I'll give you a second.
Okay. 10. Thank you.
10. Okay. So at 10, I would say that's a hard age, because it's kind of, if they had been a little bit older, I would have said that, at 10, I feel like you should still be honest, but there's that balance of not giving too much information. So, kind of saying that, we did some testing and it shows that, it's hard to predict that there's a genetic risk, but again, I don't have the background in cardiomyopathy. In terms of, I would ask, the cardiologist, I guess I would need more information in terms of with that specific genetic, risk factor, like what percentage of children go on to develop, cardiomyopathy. And I think that would help determine whether the child should be informed. But definitely as they got older and were, adolescent, I would encourage, the parent to let them know the increased risk. But at 10, there's that risk of that too much information and stressing the child. But at 10 also, they are able to understand a lot. And especially if they have a sibling who they're seeing go through this, they have a greater understanding. But I do think it would depend kind of on the overall risk, and I don't have that information. But like I had said before, kids know a lot more than we give them credit for. So if they're asking, I do feel like being honest is always the best policy, but it's also, there's that fine line of not completely, the scariness of that diagnosis. So kind of finding that balance. I don't know, that wasn't the best answer, but 10's kind of a hard age, to kind of, a lot of it does depend on the child in terms of where they are maturity wise, and how much they understand.
Okay, thank you. That was all the questions that we received. So I just wanted to thank you again, Dr. Monteiro, for spending your hour with us and sharing your expertise. We really appreciate it. Thanks again for joining us.
Okay, well, thank you for having me.
Thank you. I just wanted to remind everyone that, and you're getting a few people commenting thank you in the chat box. So it was very well received. Thank you. I just wanted to remind everybody on the call. I know we have mostly CCF members on the call, but we also have a few people that are joining with us for the first time as guests, or maybe you're new to Children's Cardiomyopathy Foundation. And I just wanted to remind everyone that we offer a variety of services at CCF. As Dr. Monteiro was talking about developing a support system, we have lots of different resources and ways that we can connect you with other affected families that have similar experiences. We have resources for children. We have a school resource kit that can help families with school-age children work with the school to ensure that their child is adequately supported with their diagnosis within the school. And we have a Cardio What book that helps to explain cardiomyopathy to the younger children. So we have lots of educational resources and different support services. So I encourage you to reach out to us at any time with any questions or for more information on any of those. Our website is childrenscardiomyopathy.org. And again, this presentation is going to be available on our website if you ever need to refer back to it. We really enjoyed having you join us. Thank you for everyone who joined us this afternoon, and I hope that everyone has a great day. Thanks again. Take care.